The Shishugou Formation in northwestern China was a highly competitive ecosystem during the late Jurassic. At the top of its food chain sat a massive 7-meter theropod, Sinraptor dongi. The holotype skull for this massive apex predator, scientifically designated as IVPP 10600, demonstrates formidable size and structural density. Yet close inspection reveals an anomaly. Paleontologists mapped exactly 28 partially healed tooth strike lesions across the skull. These precise bite marks, inflicted by other Sinraptor, document a life cycle of extreme face-biting combat and a violent feeding ecology. To understand how an animal endures and inflicts this level of mechanical trauma, we have to reverse engineer its primary weapon system, the dental architecture. Theropod dinosaurs constantly shed and replace their teeth, leaving thousands scattered across fossil sites. Yet, matching a single shed tooth to a specific species is notoriously difficult. Historically, classification relied on qualitative descriptions. The problem is that almost all large blade-toothed or xiphodont theropods look superficially identical. To bypass this limitation, researchers applied a rigorous quantitative framework. They combined precise crown-based morphometrics, measuring specific ratios of base width to height, with high-resolution structural analysis of the enamel and serrations. This mathematical approach isolates Sinraptor from the background noise of the Shishugou Formation. It also establishes an extreme biomechanical convergence with a famous North American predator, Allosaurus. By converting physical anatomy into statistical data, the study moves past subjective descriptions to establish the specific mechanics of the jaw. The physical breakdown begins at the front of the jaw, focusing on the mesial dentition housed in the premaxilla and the anterior dentary. When measuring these front teeth, paleontologists rely on two intersecting planes, the mesial distal axis running front to back and the labial lateral axis running outside to inside. The data reveals extreme thickness along the labial-lingual plane. These front teeth carry a high crown-base ratio, measuring between 1.35 and 1.42. The most critical structural anomaly is the mesial carina, the front serrated edge. It does not descend in a straight line. Instead, it spirals aggressively inward, curving linguomesially toward the base of the crown. If you cut this tooth at the cervix, that twist creates a highly specific geometric outline, an asymmetrical Salonon shape or a distinct J shape. This spiraling, thick-based geometry creates a structure highly resistant to torsion, an engineering adaptation required to absorb twisting impacts of bone-crunching grips. Moving down to the microscopic level, the serrated carinae do not stop at the visible crown. They extend all the way to the root base. Looking closely at the trailing edge of the tooth, the individual distal denticles form strict, horizontally subrectangular shapes. The interdenticular spaces separating these individual serrations are unusually wide. Plunging between these denticles are deep, well-developed grooves known as interdenticular sulci. The surrounding enamel lacks smooth uniformity, exhibiting a highly irregular, non-oriented surface texture. This enamel is further reinforced by closely packed transverse undulations, band-like wrinkles extending across the labial and lingual sides. At the extreme end of the tooth, the physical tips of these crowns display extensive apical spalling, severe chipping and flaking of the enamel itself. Deeply grooved serrations, reinforced enamel wrinkles, and fractured tips provide the physical fingerprint of regular, high-velocity tooth-to-bone contact. Tracking backward along the jawline and to the maxilla, the dental architecture completely changes, displaying strict positional variation, known as heterodonty. The crown-base ratio drops severely in this lateral section. The teeth abandon their thick, rounded profiles and become highly compressed side to side. The trailing serrations also shift orientation. They become weakly deflected labially, meaning they point slightly outward from the jaw. Toward the bases of these lateral teeth, the central surfaces on both the inside and outside of the crown feature distinct flat or concave depressions. These opposing dual concavities pinch the tooth in the middle, creating a highly specific figure 8-shaped cross-section at the cervix. The severe transition from thick, gripping premaxillary teeth to highly compressed outward flaring lateral teeth proves the jaw was engineered for a dual-function mechanical strike.
This chart plots 15 distinct tooth measurements into a visual morphospace through a discriminant function analysis. The data maps the premaxillary, maxillary, and dentary teeth into 3 clearly separated clusters. The geometry is so precisely defined that researchers can analyze an isolated shed tooth and use this statistical matrix to pinpoint exactly where it sat in the jaw. Feeding the global Avarostran theropod dataset into the graph reveals a broader reality. The data cluster for Sinraptor completely overlaps with Allosaurus, while separating from related Carcharodontosaurids. This statistical overlap indicates that these 2 distinct lineages arrived at a nearly identical solution for processing prey. Based on these anatomical constraints, we can accurately reconstruct the strike and tear kinematics utilized by Sinraptor. The jaw snapped downward. The robust J-shaped front teeth absorbed the catastrophic vertical impact as they drove into the prey's bone. Immediately upon impact, massive neck muscles drove ventroflexion, violently pulling the skull backward and dragging the highly compressed lateral teeth through the prey. As the skull pulled back, the widely separated carinae and outward deflected serrations engaged. They physically sliced and pulled the flesh apart simultaneously. The physiological outcome for the prey was immediate. This architecture was designed specifically to inflict massive, widely opened wounds that induced rapid, fatal bleeding. Analyzing these microscopic serrations and dental datasets allows us to quantify the mechanical constraints of the late Jurassic apex predator.